Hello and welcome. Today we're diving into a fascinating, yet often overlooked, condition affecting the urinary system and beyond: cholesterol emboli syndrome, also known as atherosclerotic disease. So, what causes this condition? Cholesterol emboli syndrome occurs when small cholesterol crystals, dislodged from larger atherosclerotic plaques in arteries, break free and travel through the bloodstream. These plaques are typically found in the aorta, the body's largest artery. The dislodgement often happens spontaneously, but can also be triggered by medical procedures like angiography, angioplasty, or even surgery. Even the use of anticoagulant or thrombolytic medication can increase the risk of plaque disruption. Now, let's look at the pathophysiology. Once these cholesterol crystals are released, they act as tiny emboli, lodging themselves in small blood vessels throughout the body. When these emboli lodge in smaller arteries, they obstruct blood flow. This obstruction leads to ischemia, meaning a reduced supply of oxygen and nutrients to the tissues supplied by those vessels. This ischemic injury triggers an inflammatory response, further damaging the affected tissues. In the urinary system, this most commonly affects the kidneys. The severity and location of the emboli determine the extent of organ damage and the range of symptoms a patient might experience. Cholesterol emboli syndrome is not particularly common, but it's also likely underdiagnosed. The incidence increases with age and is higher in individuals with advanced atherosclerosis, hypertension, diabetes, and chronic kidney disease. People undergoing vascular procedures, especially those involving the aorta, are at an increased risk. While exact figures are difficult to pinpoint, studies suggest it occurs in a small percentage of patients undergoing cardiac catheterization. The signs and symptoms of cholesterol emboli syndrome are highly variable, depending on which organs are affected. Common manifestations include skin changes, such as livedo reticularis, a mottled, net-like pattern on the skin, particularly on the legs and feet. Kidney involvement can lead to acute kidney injury or a gradual decline in kidney function, high blood pressure, and protein in the urine. Other symptoms can include abdominal pain, weight loss, muscle pain, stroke-like symptoms, or even pancreatitis. Because the symptoms can mimic other conditions, diagnosis can be challenging. Diagnosing cholesterol emboli syndrome requires a careful clinical evaluation and often involves a combination of blood tests, urine tests, and imaging studies. Blood tests may reveal elevated creatinine levels indicating kidney damage, and increased erythrocyte sedimentation rate (ESR), or elevated C-reactive protein (CRP), both markers of inflammation. Eosinophilia, an elevated level of eosinophils in the blood, is also frequently seen. Urine analysis may show protein or blood in the urine. Imaging studies, such as CT angiography or arteriography, may help visualize the source of the emboli. However, the gold standard for diagnosis is typically a tissue biopsy of an affected organ, such as the kidney or skin. The biopsy can confirm the presence of cholesterol crystals within the small blood vessels. Cholesterol emboli syndrome isn't generally classified into distinct types. Its presentation is determined by the specific organs affected and the extent of the embolic shower. Unfortunately, there's no specific cure for cholesterol emboli syndrome. Treatment is primarily supportive and focuses on managing symptoms and preventing further embolization. This may include controlling blood pressure, managing kidney function with dialysis if needed, and addressing any other organ-specific complications. Statins, medications to lower cholesterol, may be used to stabilize existing plaques and reduce the risk of further embolization. Antiplatelet agents may be considered in some cases. In rare instances, surgical removal of the atherosclerotic plaque in the aorta may be an option, but this is a high-risk procedure. Prevention is key. Managing underlying risk factors for atherosclerosis, such as high blood pressure, high cholesterol, and diabetes, is crucial. When undergoing vascular procedures, careful technique and minimizing manipulation of the aorta can help reduce the risk of dislodging cholesterol crystals. Weighing the benefits and risks of anticoagulant and thrombolytic medications is also important, especially in patients with known atherosclerosis. The prognosis of cholesterol emboli syndrome is variable. In some cases, the condition may be mild and self-limiting, while in others, it can lead to significant organ damage and even death. The prognosis depends on the severity of the embolization, the organs involved, and the patient's overall health. Recent research focuses on identifying biomarkers that can help with early diagnosis and predicting disease severity. There's also ongoing investigation into potential therapies that can reduce the inflammatory response and promote tissue repair. While much remains to be understood, continued research offers hope for improved outcomes for patients with cholesterol emboli syndrome.